Everyone. I am Laurence Richard, but you can call me Lo. I'm the Marketing and Communications Coordinator here at PHA Canada, and I am with Dr. Sanjay Mehta. Hello, Sanjay.
Et Laurence, bonjour.
Donc, bonjour tout le monde. On est ici avec le docteur Sanjay Mehta. Je suis la coordonnatrice en marketing et communication à la HTP Canada. So I'm currently at home, working from home in Vancouver, like the whole team here. So you can still send us your emails, send us your questions on Facebook. You can still call us. We're available. And we're here to answer your questions about COVID-19. And so we were supposed to have a Facebook Live session, but we had technical issues. So we're just recording a video for you guys. We've been answering questions on Facebook with Dr. Mehta. We've been trying to translate them in French as well. But right now we're going to answer more questions on this video. Donc, on était censé avoir un Facebook Live, un Facebook en direct, mais on a eu des problèmes techniques. Donc, on va procéder avec une entrevue avec le docteur Mehta par l'entremise de cette vidéo. On a commencé déjà à traduire des réponses du docteur Mehta sur Facebook, puis on va certainement partager toutes ces réponses-là par la suite sur la page en français de l'association. So, Dr. Mehta, I think we can start directly with Nicole's question. I can ask the question and then we can go forward with your answers. So first of all, we have Nicole asking, should PH patients be doing anything differently than the average person during this time? And how much more at risk are we given our already weakened lungs?
Well, it's a very important question. Clearly, all of us at PHA Canada and your PH physicians across the country, PH patients and their caregivers are all worried about you and us. And so the important thing is pulmonary hypertension is a lung disease, as you've heard about, but it's a little different than many lung diseases. It doesn't affect the bronchial tubes like asthma or COPD. It doesn't affect the tissue of the lung, like scarring of the lung. So it's not as high risk as many lung diseases to get very sick if you were to get COVID. And yet, many of our PH patients obviously are quite ill, especially with heart failure, which, as you know, affects the right side of the heart, especially the right ventricle or RV. If you have heart failure, I would be worried that you're at higher risk if you got COVID of getting quite sick. As well, people don't often just have pulmonary hypertension. They often have other lung diseases, other heart diseases, diabetes, and clearly those put you at higher risk. I think every PH patient and caregiver has to do what they can to protect themselves. And those are the simple things you're hearing. Isolate yourselves, social or physical distancing, very rigorous, regular hand washing with alcohol or soap, and then limit the social contacts. You have families, you can interact with them, teach them about physical distancing and washing, but you can definitely still get together with them. So overall, I think PH patients are not as high risk as many patients, but definitely individually look after yourselves, the most important.
So there's a lot of content to translate here. I will do my best. I think I can just start by saying some by translating the general idea, and I think that Dr. Mehta can complete afterwards. Donc, nous sommes tous inquiets pour nos patients et nos proches aidants. En général, l'HTP n'est pas une maladie à haut niveau de risque pour contracter une maladie comme le COVID-19. Par contre, certaines personnes atteintes ont des conditions plus sévères d'insuffisance cardiaque du côté droit du cœur et seraient plus à risque d'être gravement malades. De plus, d'autres personnes atteintes d'hypertension pulmonaire ont d'autres conditions pulmonaires ou cardiaques. ce qui signifie que tous les patients atteints d'HTP doivent suivre les recommandations d'auto-isolement, d'hygiène stricte des mains, donc se laver les mains avec de l'eau et du savon, etc. Donc vraiment suivre les recommandations. Puis aussi, soyez à l'affût des symptômes que vous avez, puisque certains symptômes peuvent être plus en lien avec votre HTP qui s'empire qu'avec le virus en tant que tel.
Ben, c'est bien fait, c'est parfait, Laurence.
Génial. Maybe we can go with another question that we have here.
The next one I see is Sonia Collins about
Yes.
socializing.
Perfect. Yes. So Sonia is asking, actually, she's writing, I came up with an idea to have a coffee break with my friends in our yard. I just want to make sure that it's okay. Everyone is going to bring their own camp chairs and coffee in their travel mugs, and for fun, lay down broomsticks between us to keep our distance at 8 feet. Nobody would be touching anything belonging to us or anyone else or going in the house. They would just go home when our coffee is done. Is this putting me or anyone else in higher risk when we are keeping our distance outdoors?
Sonia and others, we all need and can continue to connect with people. It's one of the most basic things of being human. However, in this day and age, you want to do so as carefully as possible, obviously to not get sick, but also slow down the spread of COVID in our communities, which you've heard is the best way to allow hospitals and healthcare system to deal with those who does get sick. My wife Linda and I like to go for a walk and we meet neighbors. We obviously keep our distance, more than 6 feet, but you can chat with them. You're not going to get COVID just chatting with somebody on the street or socializing. So Sonia's idea of having people over, bring their own coffee and or snacks, but staying well separated while you talk, laugh, joke is perfectly fine. Clearly, the less people you contact, the better. I would keep it to a small number, but the most important thing is no close contact, no physical, but yes, definitely social interaction is still important.
Definitely. Donc, pour la question en français, Sonia a demandé au docteur Mehta si c'était correct d'inviter des gens chez elle, s'ils sont à l'extérieur, s'ils gardent une distance de 8 pieds entre eux. Donc, le docteur Mehta répond que nous avons besoin et continuons d'entrer en relation avec les gens, rester en contact de façon sécuritaire pour ralentir la propagation du virus, c'est très important. Donc, la femme du docteur Mehta, Linda, et lui, ils vont marcher et s'arrêtent pour parler aux gens tout en gardant 6 pieds de distance. Donc, si vous prenez une pause de café en partageant rien d'autre que des rires, en apportant vos propres collations, vos propres choses, puis que vous gardez vos distances, bien, c'est bien correct. Perfect. So we can go with Judith's question. She asked, are we better off going to the hospital or CLSC for routine blood work, or is it better to get a nurse to come to our house?
So Judith, it's very important that we limit contact with patients, especially in the settings where there's the most people and the highest risk of getting COVID. And this clearly is hospitals, clinics, blood-taking labs. And so you definitely want to limit that as much as possible. If you're able to, then definitely getting a nurse or a technician to come into the house to draw your blood is fine and probably better. Remember, patients on pulmonary hypertension medications need to have their blood tests done roughly every month, especially to monitor liver and kidneys, especially on certain medications. But also diabetes patients need it monitored. People on Coumadin need their blood levels of the coagulation monitor. So this is very important. If you can't do it at home, then going into a clinic or lab is fine. They're all set up to receive patients, to isolate them and keep them safe. And if somebody is sick, with an infection, cough, cold, fever, they are not being looked after there. They're being sent to the hospital. So I think the risk is quite low. Remember, if you want to set it up at home, the pharmaceutical companies who make pH medications have set it up that they will look after the home blood draws. So talk to your pH clinic, and I'm sure that can get set up for you.
Donc, pour la traduction en français, Judith a demandé si c'était mieux d'aller à l'hôpital ou dans des cliniques pour des prises de sang ou d'avoir un ou une infirmière qui vient à la maison. Le docteur Mehta dit que le plus important est de limiter les contacts avec le plus de gens possible pour réduire les risques d'attraper la COVID-19. Donc, ça inclut les déplacements dans les hôpitaux, dans les cliniques, dans les laboratoires de prise de sang. Puis, si vous pouvez avoir un infirmier ou une infirmière qui vient à domicile pour faire les prises de sang, c'est beaucoup plus sécuritaire. Notez que les compagnies qui traitent l'hypertension pulmonaire soutiennent les prises de sang à la maison, donc ils ont des programmes pour ça. Pour les patients, les personnes atteintes d'hypertension pulmonaire. Donc, vous pouvez demander à votre clinique d'organiser une prise de sang directement à votre domicile. Est-ce que ça répond bien en français?
Excellent. Bien fait encore.
OK, parfait. On peut aller avec la question de Beth. So Beth's question is surrounding the masks. What is the latest and why homemade masks are discouraged as they are better than nothing if someone coughs in your face? And if they are homemade, do you recommend we wear them?
So Beth, masks are important always to the spread of infection and decreasing that risk. This has been known for hundreds of years since the days of tuberculosis and now definitely in COVID. However, they're most helpful if somebody has infection, them wearing the mask so they don't spread it around. And that's what we do in the hospital. As well, the truth is these days, if you're sick and you're coughing, sneezing, fever, you should not be going out where you could spread the infection unless you have to a clinic or a hospital. The problem is if you're well and you want to protect yourself, to wear a mask, there's very little evidence that that actually protects you. If anything, all of you have learned that most respiratory infections aren't coughing, sneezing in your face. They're you touching something that somebody else has touched and left the virus on. So this is something called fomites, the spread of infection through other materials, for example, clothing or the desktop or a handle. And so if you're going to be doing that, it's on your fingers. If you have a mask on, there's good evidence that people touch their face more. You adjust the mask, you adjust your glasses, you touch it. So you actually have a higher risk perhaps of getting sick if you're wearing a mask if you don't need it. Now, this is medical masks. All the other ideas of wearing a scarf or wearing something homemade or that, there's no evidence that that's going to do anything either. I think the right thing to do is the rigorous hand washing, avoiding sick people, decreasing social contacts. Those are much, much more important than wearing a mask.
Donc, la question de Beth concerne les masques. Donc, est-ce que c'est important de porter un masque? Est-ce que c'est la moindre des choses si quelqu'un vous tousse au visage? Est-ce que les masques qui sont faits à la main devraient être portés? Et le docteur Mehta répond que les masques sont très importants pour prévenir la propagation du virus, mais surtout dans des contextes médicaux, pour les professionnels de la santé qui sont à haut risque de contracter le virus et qui ont des contacts réguliers avec des patients qui sont atteints du virus. Puis il y a peu de preuves qui démontrent que les masques préviennent de contracter le COVID. Donc, les masques qui sont faits à la main ne préviennent pas les germes ou les bactéries de se se répandre sur les côtés. Puis on a tendance à plus se toucher le visage quand on porte un masque ou quand on met un foulard sur notre visage. Donc, en fait, il y a un risque plus élevé de vous infecter vous-même, puisqu'il est plus tentant justement de se toucher le visage. Donc, c'est pas recommandé pour tout le monde.
Laurence, there was an earlier question from Tarja Morel that I think we should attack because I think lots of people are going to be interested in this. Do you see it? It was the one that she posted 51 minutes ago, or do you want me to go ahead and read it?
Yes, I see it. I will read it and I will try my best to translate it.
Well, I'll answer it.
All right. Okay, perfect. So Teria is asking, is it reasonable to assume that PHers who are stable on medications are at less increased risk? Might be the case if our disease were unstable. How much of a difference might that make to our general risk profile?
So Taria and others, this is really important. As I said a bit earlier, pulmonary hypertension is not what we think is one of the highest risks to get sick, very sick from COVID if you were to get it, in terms of getting pneumonia in the hospital and critically ill, and yet it could be. If you're generally well and your pulmonary hypertension is under control, which means you're well, you're active, you have minimal signs of heart failure, which is swelling of the feet and ankles, very tired. If those are not the case, then I think you have much lower risk of getting very sick. Clearly, some of our patients, even with the best medications, the pulmonary hypertension can't be controlled as well as we'd like. So if you have more heart failure, if you're sicker, then there is a higher risk. We are quite fortunate, as you know, that we have lots of pH medications available. And many patients in Canada now are on 2 or 3 medications, so it's clear that most of our patients are doing better, and thus they have lower risk of getting very sick from COVID.
Do you want to risk translating that for us?
Je pourrais essayer. Taria nous demande si un patient avec l'hypertension pulmonaire est bien contrôlé, sont bien stables, sur le médicament, est-ce qu'ils ont moins de risque de tomber très malade avec COVID? Et absolument, c'est vrai, nos patients avec l'hypertension pulmonaire qui vont bien, qui sont actifs, qui sont bien contrôlés, qui ont très peu d'insuffisance cardiaque de côté droit, ont très peu de risque de COVID. Par contre, c'est dommage que tous nos patients avec l'hypertension pulmonaire ne sont pas aussi bien. Il y a ceux qui souffrent toujours d'insuffisance cardiaque droite, eux autres sont un peu plus à risque de tomber très malades. Et puis donc pour eux, c'est très important de se garder isolés, de régulièrement laver les mains bien et faire cette social physical distancing dont on parle pour diminuer leur risque.
Great, thank you so much. So was there any other question you wanted to talk about on this video, or?
Yeah, I think there was another good one from Jas James, our friend and PHA Canada ambassador it's in Victoria, Vancouver Island in British Columbia. So Jas lives with her husband. She says they live in the same house. Her husband goes out to get groceries, and so what should she do when he comes back in terms of physical distancing? Especially since she has pulmonary hypertension, but also has an immune issue as well. So she'd be at higher risk for COVID. And so, Jas, very important issue. Many PH patients live with partners or children or parents or other caregivers. And clearly, some of those caregivers and partners need to go out either for supplies or to go to work. And that's important, obviously. So the challenge is even if you're isolated, and your partner's caregivers going out, they can get infected. And remember, many people, we think, get infected with COVID and have no symptoms. So they could bring it home and infect a PH patient as well. So you want to be careful about that. What that means is the person going in and out looks after themselves. They wash their hands regularly when they're with other people, when they come in the door, ideally probably change their clothes. And at the same time, good physical distancing in the house, and especially not sharing cups, cutlery, things like that. As well, cleaning surfaces. We mentioned how this infection spreads from surfaces, and so making sure that they're cleaned every day so that there's less of a chance of spreading it. As well, if your partner has done the good hand hygiene and protected themselves, I don't think we want to stop all physical contact. I think it's perfectly fine to have a little contact, to kiss, maybe more, that's up to you. But again, remember the issue is not to completely stop COVID spread. It's going to spread. What we're really hopeful is that people distancing and controlling the spread slows it down enough so when people get sick, we can look after you. That's really important. But if it spreads quickly and we get overwhelmed like Italy or New York, then we're going to be suffering and unfortunately more patients could die. But it's slowing it down, doing what you can to protect, but also again, a little bit of social contact is a good thing.
Donc, Jazz nous a demandé s'il fallait qu'elle applique les règles de distanciation de 2 mètres avec son mari, puisque il doit aller au travail, il doit aller à l'épicerie, donc il y a des risques d'apporter le virus dans la maison. Donc, le docteur Mehta nous répond que oui, c'est important d'appliquer ces règles-là. C'est sûr qu'il y a des gens qui doivent continuer d'aller travailler, qui doivent aller à l'épicerie, donc qui peuvent apporter le virus à la maison. Donc, c'est pour ça que c'est important de se laver les mains, c'est important de laver toutes les surfaces aussi, parce qu'on sait que le virus peut vraiment se répandre sur les surfaces et survivre. Par contre, évidemment, on vit ensemble, donc le but, c'est de réduire la propagation, réduire les risques pour que le système de santé puisse prendre soin des gens qui sont infectés par la suite. Par contre, c'est sûr qu'on peut avoir des contacts physiques. Il faut continuer quand même. On est tous humains, donc on peut continuer à s'embrasser, peut-être un petit peu plus. Ça dépend de vous. Donc, je pense que il faut quand même faire très attention, mais en même temps, on reste tous humains. Voilà.
Laurent, there was a good question from Michelle Hanofsky about the shortage of pH medications. Did you see that?
Yes, I can see it here. So I will read it.
Go
So
for it.
Michelle is asking, is there any cause for concern for pH medication shortages? Generally, I like to try and renew my medications at least 2 weeks prior to needing them, but am worried that there may come a time, and I'm gonna spread that question, that there may come a time when there's a shortage of supply. However, I do understand that there shouldn't be an increased demand for pH-specific medications, and the hoarding of this medication is near impossible for most due to the money of, the cost of the medication.
Mm-hmm. Yeah, so Michelle, you raise an important point because there have been ideas that there is a shortage of some medications developing in our communities, specifically antibiotics like azithromycin, because there are some reports from China that it might be effective at treating COVID. It hasn't been very strong evidence, so it's not something that most of us right now are using or believe. And also you might have heard of this immune medication called chloroquine or hydroxychloroquine, which is used for some rheumatologic and immune conditions like lupus and others. People have been hoarding it. Even, unfortunately, colleagues, physicians around the world have been prescribing it for friends and family, which is really disappointing. It's not the right thing. However, specifically with regards to pulmonary hypertension, there has been no issue about a shortage of medications potentially. Again, we're a little bit lucky in that luckily it's still an uncommon disease. Remember, we think 5,000 to 10,000 people in Canada. And so this is not hundreds of thousands of patients or millions of patients. And so there really has been no issue, no concern about availability of pH medications. And I don't expect this to be an issue at all going into the future.
Donc, Michel a demandé au docteur Mehta si on devrait s'inquiéter du manque de médicaments pour les personnes atteintes d'hypertension pulmonaire. Ce que le docteur Mehta répond, c'est que c'est encore une maladie qui est rare. Donc, il y a environ de 5 000 à 10 000 personnes atteintes au Canada. Donc, pour le moment, ben, en fait, ce n'est pas un risque à prévoir, le fait de manquer de médicaments pour l'hypertension pulmonaire. Donc, on n'a pas à s'inquiéter de ça. Par contre, peut-être que le docteur Mehta peut préciser un petit peu plus le début de sa question avec les médicaments précisément.
Oui, certainement. Donc, peut-être les gens ont déjà entendu qu'il y a des essais qui sont en train de se faire, des recherches de médicaments spécifiquement azithromycin. C'est un antibiotique qu'on utilise assez fréquemment pour la pneumonie. Et puis l'autre, c'est un médicament chloroquine ou hydroxychloroquine qui est utilisé assez souvent pour des maladies rhumatologiques ou immunologiques comme le lupus. C'est vraiment décevant pour nous des médecins qu'on a des collègues partout au monde qui commencent à prescrire ça déjà pour leurs amis, leurs familles, pour garder ça en cas où ils tombent malades avec COVID. Mais il y a très, très peu d'évidence que ça marche pour COVID et c'est inquiétant qu'il y ait un manque maintenant de ces médicaments pour les gens qui ont vraiment besoin. Donc nous, on n'est pas en train d'utiliser ça pour COVID, puis on garde ça pas pour ça, on le traite appropriément les gens qui ont besoin de ces médicaments. Et pour les médicaments d'hypertension pulmonaire, pas de problème d'avoir assez pour les gens qui ont besoin.
Perfect. Did you see another question that you would like to talk about?
Well, there's a good question from our friend and PHA Canada board member, Ed Rathany. So Ed's in British Columbia. He has a daughter with pulmonary hypertension. And so Ed posted this 39 minutes ago. Maybe I'll start reading it slowly. You can find it and also think about the answer. So Ed has routine appointments at the hospital, obviously with his daughter. And there are restrictions in every hospital now, how patients come in, unfortunately, often without visitors allowed to come in with them. And that might work for adults, but not for children. They still have to come in with a visitor. And so Ed's asking, are there new standard protocols for how is the safest way to come into a hospital, protect people? And if so, how are patients advised of that? So it's a fairly complex question. And Ed, the challenge is every hospital, every province is different, unfortunately. As you know, healthcare is a provincial responsibility. And so people are deciding this based on provincial ministries of health and also what they can offer on the ground in terms of different physical entrances to the hospital, how they can protect people. I think the right thing to do is, since you go to one hospital with your daughter, is contact them, make sure you're clear how to do this safely. What it's going to mean typically is when you show up, the first thing is they're going to screen you and your daughter. Do you have symptoms potentially of COVID? Fever, cough, sore throat, shortness of breath. Have you traveled? Have you been exposed to somebody with COVID? Those are the important questions that I get asked every day when I go into the hospital as well to screen me. So you're going to get asked those. Assuming there's nothing, then they will guide you to where you need to go with the least contact possible with other patients, other staff, except the ones that you need to meet that day for your daughter's care. So I have very, very high confidence that the hospital is the lowest risk for somebody to pick up COVID. This is being done very well, so I would not worry about those procedures and processes. We are very confident right now to protect people that come into our care.
Donc, Ed nous a demandé s'il y avait si on a des conseils sur un protocole à adopter quand on va à l'hôpital pour des rendez-vous routiniers parce que sa fille est atteinte d'hypertension pulmonaire. Donc, ce que le docteur Mehta répond, c'est que il faut faire attention, évidemment. Il faut seulement voir les professionnels de la santé qu'on doit voir, qui sont nécessaires de voir et d'entrer en relation. Par contre, les hôpitaux en ce moment sont ils font beaucoup de prévention, donc c'est très bien fait. Donc, il y a pas beaucoup de risques de contracter le virus dans un hôpital. Par contre, il y a des procédures qui sont différentes pour chaque province. Donc, c'est sûr qu'il faut s'informer selon la province. Mais évidemment, il faut suivre les recommandations générales d'hygiène et de faire attention, de se laver les mains et tout ça. Mais on peut quand même aller à l'hôpital pour les rendez-vous routiniers.
Laurence, there's a good question by Ilana about 16 minutes ago. Do you see that one?
Maybe you can start
Sure.
asking.
Yeah, sure. So Ilana asks a very good question because many patients are worried about this. The symptoms that you might have as a patient with pulmonary hypertension can, of course, be very similar to what symptoms you might get with COVID. Shortness of breath, sometimes cough, and so it might be difficult to know. And Ilana says exactly that. How does she differentiate the cough she normally has from the one that COVID brings? This is a challenge always with somebody with lung disease who has regular symptoms, for example, COPD or asthma. What we've always said is you're smart. You know your illness, monitor yourself. You know the symptoms you have day to day and how they might fluctuate a little bit. But clearly, if there's a change, if, for example, you're coughing more, or if you have breathing issues, but now you're more short of breath, then you have to ask yourself, what's going on? Is my illness getting worse? And that, of course, can happen with PH. Or have I picked up something like an infection or COVID? As well, the separate symptoms to always look for: fever, sore throat, nasal sinus congestion, other symptoms of infection should really make you think that, yes, you might have picked up an infection, possibly COVID. So it's not an easy thing, but again, most of you live with this every day. You understand your illnesses. So I would trust you to monitor yourselves and see if there's a change from your usual.
Mm-hmm. Donc, Ilana nous a demandé comment différencier une toux qui est liée à son diagnostic de CTEPH in French is MPT.
Oh, ça, c'est une bonne question. Je rappelle que je connais aussi. J'imaginais c'est la maladie d'hypertension pulmonaire thromboembolique.
Exactement. Merci beaucoup. Donc c'est ça. Donc, elle nous demande comment faire la différence entre une toux par rapport à sa maladie versus par rapport au virus. Je crois que le docteur Mehta peut m'aider à traduire ici, mais c'est ça, qu'il faut faire attention à ses propres symptômes, que vous êtes assez conscient de votre corps pour faire la différence, mais qu'il y a quand même des indices là, qu'on peut identifier.
Exactement. Donc, certainement, il y a des symptômes qui sont communs entre des maladies de poumon comme l'hypertension pulmonaire et l'infection COVID, surtout l'essoufflement, parfois la toux. Donc, ce que je vous suggère, c'est vous connaissez bien vos maladies, vous connaissez les symptômes dont vous vivez avec de jour à jour. Ça varie un peu, certainement, mais si vous remarquez un changement dans vos symptômes, il y a quelque chose qui se passe. C'est-tu peut-être l'hypertension pulmonaire qui commence à s'empirer? Ça se peut. Ou c'est-tu une infection comme le COVID ou d'autres? Donc vraiment, on a de confiance dans vous de vous monitorer et si vous ressentez que quelque chose va pas bien, il y a une différence, là, c'est important de contacter vos médecins, vos équipes d'hypertension pulmonaire.
Je pense aussi que c'est important de faire attention si on a de la fièvre en particulier.
Exactement.
Parfait. Super. Est-ce qu'il y a une autre question que vous aimeriez aborder?
Oui, il y avait une bonne question de Diane Gale, quelque chose qu'on a déjà discuté un peu sur Facebook. C'est la protection qui peut venir des vaccins qu'on a déjà dans la communauté. Il y a plusieurs qui vont avoir déjà reçu le vaccin pour l'influenza, le flu vaccine, ou le vaccin pour la pneumonie. Et c'est important de savoir que le virus qui cause le COVID, ça s'appelle le SARS-CoV-2, c'est complètement différent. Il y a d'autres virus aussi aux bactéries, aux germes, comme le streptococcus qui cause pneumonie dans d'autres personnes. Donc, il n'y a aucune évidence que les vaccins que vous avez peut-être déjà reçus pour le flu ou la pneumonie vont vous protéger de COVID. Vous savez bien que peut-être la recherche se passe très vite pour essayer de trouver un vaccin pour COVID. Mais ça prend du temps. Ça va être au moins 6 mois, peut-être plus long, avant qu'on ait le vaccin pour COVID. Sorry, I got confused and I started in French. So I'll go back to English. So Diane Gale asked, she's had her flu shot and the pneumonia shot, and will that protect her from COVID? And so unfortunately not. Remember, each type of virus or bacteria are very distinct genetically and in terms of your immune response. And so COVID, there is no vaccine yet. And so the flu vaccine, important for all of us to get every fall, winter, will protect you against influenza, but that's it, not COVID. As well, the pneumonia vaccine protects against a bacteria or germ that causes pneumonia in many people, called Streptococcus pneumoniae, protects against pneumonia, but not against COVID. And so do not think that you're protected if you've had the other vaccines. You also know that research is going on. It takes time to develop vaccines, and we are hopeful we'll get there, but we're looking at least 6 months till we have an effective vaccine for COVID, unfortunately, and maybe even longer.
Mm-hmm. We have a question from Teria here. She is asking, are there any data yet on outcomes for PHers who get COVID-19?
Yeah, obviously a concern of ours in London, none of my patients have gotten sick with COVID, luckily, that have been very sick, admitted to hospital. And I haven't heard from my colleagues either. Again, we're quite fortunate. Remember, pulmonary hypertension, 5 to 10,000 patients in Canada. So somewhere around 1 in 3,000, give or take. And so quite uncommon still. Remember, there's been a lot of cases in Canada, but still only about 100,000. And so the risk is still quite low. As well, let's remember, very importantly, many patients who get COVID, get infected with the virus that causes COVID, may not have any symptoms. We call that asymptomatic. And that's a problem because they can still spread it. So PH patients may have had it already and not gotten sick. As well, the vast majority of people who get COVID, it's mild. It's a little cold, runny nose, sore throat, maybe a little fever. It could be like a flu, a little achiness, fever, headache. But again, not sick enough to get pneumonia or get into hospital. So that may already have happened. Some of you may already have felt those symptoms. And so I haven't heard anything specific. We haven't had any PH patients get terribly ill or luckily die yet of COVID. It is obviously a risk that we're watching for.
Donc, Teria demande si il y a déjà des données sur des personnes atteintes d'hypertension pulmonaire qui ont contracté le virus. Donc, le docteur Mehta répond que non, il n'y a pas encore d'évidence qu'il y a des gens atteints d'hypertension pulmonaire qui ont reçu un diagnostic de COVID-19. Nous, on est encore très chanceux parce qu'il n'y a personne qui est décédé non plus du virus. Par contre, il faut se rappeler que les symptômes du virus peuvent être très... en fait, on peut être asymptomatique ou on peut avoir peu de symptômes. Donc, peut-être que certains d'entre vous ont déjà ressenti des symptômes du virus comme un mal de tête, comme une petite fièvre ou de la toux, des choses comme ça, mais rien qui sort de l'ordinaire ou qui vous mène jusqu'à l'hôpital. Donc, ça se peut qu'il y ait des gens qui aient eu qui aient contracté le virus, qui s'en soient sortis déjà, mais on n'a pas encore de données là-dessus. Super. Okay, so did you have another question you wanted to talk about?
Yeah, there's a good question from Eleanor. She asks about things being brought into the house. So when groceries are brought into the homes, should we be concerned about handling the packages? So clearly, we mentioned before that COVID can spread not only directly with coughing, sneezing, but very often on surfaces, a term called fomites in public health. And so clearly, if somebody who has COVID touches something that they give to you, a piece of paper, groceries, a bag, whatever, be it in the work situation or at home, then yes, you could pick up COVID through your hands. This is why the best way to protect yourself is rigorous hand washing. If you're receiving things from people, have them wash their hands before they give you something. You receive it, wash your hands. If you can, absolutely perfectly fine to wash down hands, other goods like that to decrease the risk that there's any contamination of them. Because yes, it could spread that way.
Mhm. Donc, on a, sorry, remind me. Oh, Eleanor.
Yes.
Eleanor asked, so what do we do when we bring products from the grocery store or from, well, I'm speaking English, but I'm supposed to be translating in French. Donc, on a Eleanor qui nous demande ici si on doit être inquiet, si on apporte des produits de l'épicerie, est-ce que c'est quoi, quelles sont les mesures à prendre dans ce cas-là? Donc, le docteur Mehta dit que oui, c'est très important de évidemment se laver les mains parce qu'il peut y avoir des bactéries liées au virus qui sont sur les produits parce qu'ils survivent sur les surfaces. Corrigez-moi si je me trompe, docteur Mehta, mais je crois aussi qu'il est important de laver les produits en tant que tels
Mhm.
sous
Mhm.
l'eau et le savon.
Exactement. C'est important. Il y a déjà des évidences que le virus peut durer jusqu'à 9 jours sur des surfaces. And so in English, there is evidence, largely from China, which is difficult sometimes to know the reliability, but that the virus can survive for up to 9 days on surfaces. And so you don't want to take a chance. You want to be washing surfaces that might be touched or contaminated by somebody that either has COVID or might have been exposed to COVID.
Mm, exactly. Okay.
Laurence,
Perfect.
Maria had another good question, and this is about people who get sick from COVID. And so you've heard already that people, when they get very sick, this happened obviously in Italy a lot and New York, when they need to go to the intensive care unit, often they can't breathe or their oxygen levels are very low, something called respiratory failure, because they have lung failure from the pneumonia. They often need to be on a mechanical ventilator. That's the right term, sometimes called respirator, but the right term is mechanical ventilator. And then when they get better, which many people do, we have to take the tube out of their throats, take them off the ventilator, let them breathe by themselves again. And so Terry was wondering whether it's difficult for pulmonary hypertension patients to be able to be on a ventilator or to come off a ventilator. So it's a complex question. In simple terms, if you're looked after well in the intensive care unit and you recover from pneumonia, like COVID or others, and it's time for me to take the tube out and take you off the ventilator, there's many things I have to assess carefully. Are you awake? Are you alert? Are you strong enough to breathe on your own? Has the infection settled? And so very similarly in pulmonary hypertension, we would do the same. Again, pulmonary hypertension doesn't affect so much the bronchial tubes or tissue of the lung, so I don't expect a big problem. One of the ideas is when you're on a ventilator, the pressure changes in your lung can affect your heart. And hopefully all of you with pulmonary hypertension understand that the issue is a lung disease, but it becomes heart problems or heart failure on the right side. So the heart can be affected by mechanical ventilation. And when I'm taking you off the ventilator, I have to monitor your heart carefully, especially to make sure that you do fine. So mostly, I think it's fair to say if you got very sick and needed a ventilator, we would do it. and I'm quite confident we'll be able to look after you well, and when the time comes, take you off the ventilator, mostly with very little problem.
Donc, il y avait beaucoup de termes techniques dans la question et dans la réponse. Donc, je vais vous laisser faire une traduction, puis je vais pouvoir aider si jamais.
D'accord, c'est bien, j'essaierai. T'aurais demandé que si on a besoin de traiter un patient avec l'hypertension pulmonaire pour le COVID, et certainement c'est un patient qui est très malade, qui n'est pas capable de respirer, qui ont insuffisance respiratoire avec des niveaux d'oxygène très bas, ces patients ont besoin d'aller aux soins intensifs et puis parfois d'être sur un ventilateur ou respirateur. D'habitude avec un tube qui rentre de la bouche, dans la gorge, dans les bronches. Et on est capable de respirer pour ce patient. Après quelques journées, une semaine, étant disait que le patient améliore, on est prêt à enlever le respirateur ou ventilateur puis enlever la tube. Nous, on fait toujours ça pour vérifier que vous êtes prête. Vous êtes alerte, vous êtes bien conscient, vous êtes au repos, vous êtes assez fort pour respirer vous-même. Et puis on décide ça, puis après ça, on enlève le respirateur. Donc, pour un patient avec l'hypertension pulmonaire, on fera pareil pour être certain que ça va aller bien en enlevant le respirateur et le tube. La chose qui m'inquiète un peu plus, c'est que vous comprenez, l'hypertension pulmonaire, c'est une maladie des poumons, mais ça devient souvent un problème de cœur, surtout au côté droit, parce que c'est le ventricule droit qui doit travailler plus fort dans l'hypertension pulmonaire pour que le sang coule toujours dans les poumons. Donc, si vous avez des problèmes d'insuffisance cardiaque liés à l'hypertension pulmonaire, ça, c'est un peu plus inquiétant au niveau de ventilation mécanique ou être sur un respirateur. Donc là, on s'inquiète un peu, mais on est capable de vous monitorer bien pour être certain que vous êtes prête à enlever le respirateur. Pour dire à la fin que si vous avez besoin, si vous êtes très malade et on a besoin de vous mettre aux soins intensifs, pour vous mettre sur un respirateur, on le fera. Et je suis bien confiant qu'on serait capable d'enlever le respirateur après quelques journées, une semaine, après que vous améliorez avec très peu de problèmes.
Mm-hmm. Perfect. So I think we've answered a lot of questions. I think we can continue answering questions on Facebook directly. I will continue translating Dr. Mehta's questions on Facebook. But as for the video, I think it's pretty complete. Thank you so much, Dr. Mehta, for taking the time to answer all of these questions. It's going to be so helpful for the community and in French and in English.
Merci à toi, Laurent. C'était un plaisir de travailler ensemble. And again, obviously very, very happy to help you all out there learn a little more about COVID and your illnesses and look after yourselves because we do trust you to do that. But of course, if you're not feeling well, if you're nervous, reach out to your healthcare teams, your PH team especially. And obviously, always know that PHA Canada, we're there to help you as well. Reach out to us. Be well.
Yes, definitely. Thank you so much, Dr. Mehta.
Merci.
Bye-bye.